we often expect mothers to feel happy after giving birth. But what if they feel sad, overwhelmed, or emotionally drained instead? So today, we will discuss postpartum depression, a mental health condition that can affect mother after childbirth and impact both the mother and her baby. In this discussion, we will look at the signs and symptoms, risk factor, and nursing care for postpartum depression. Can anyone explain what are the signs and symptoms?
One of the most common signs and symptoms is a persistent sad mood, often accompanied by frequent crying without any obvious reason. Mother experiencing this condition may also report a loss of pleasure or interest in activity that once brought them joy, making daily life feeling overwhelming and unfulfilling. In addition, sleep disturbance are frequently observed, which may include difficulty falling asleep, even when the baby is sleeping. This lack of proper rest often contribute to weight loss and a loss of energy, leaving the individual feeling constantly fatigued and unable to carry out routine tasks effectively. Emotional instability is another key aspect, with many women experiencing agitation and heightened anxiety that can interfere with their ability to relax or feel at ease. Furthermore, negative self-perception are common, including persistent feeling of worthlessness or excessive guilt. This emotion can deeply affect a mother's confidence and her ability to cope with new responsibility. Atika, do you have any other example to add?
I have a few ideas about severe mental health symptoms. So the first one is inability to sleep more than 2 hours per day. So this is extreme insomnia, not just a normal newborn sleep disturbance, because sleep deprivation worsens the brain function and can cause increase of hallucination and confusion. So the second is thought of hurting or killing yourself. So it indicates suicidal ideation, often linked to hopelessness and emotional pain. So this is not just about hurting yourself, but it can cause hurting others, like a baby. Okay. So the third one is hearing voices and seeing things. These are called hallucination, like I said before. So the mother may be hearing voice that ask them to do something that they shouldn't do. So when a mom's couldn't have a good sleep, so they can cause a physical symptom related to anxiety. So the first one is frequent headache. So frequent headache caused by stress, tension, or lack of sleep. So the second one is chest pain and repeat heartbeat. So anxiety can increase her rate and can feel like no problem, but the anxiety related. So the third one is numbness, shakiness, and dizziness caused by hyperventilation. So the last one is SOB, shortness of breath. So mom can feel like they can breathe properly, related to anxiety that they've been through. So that's all from me. Signs and symptoms. So do you have any other suggestion about signs and symptoms? So no. So let's continue to risk factors that caused by postpartum depression.
So now I will talk about risk factor of postpartum depression. I will talk about psychological factor and social factor. So for psychological factor, these are related to mothers in mental and emotional condition. Mother with a history of depression or anxiety are more at risk, and those who had postpartum depression before also have the high chance to recurrence, and those self-esteem can make the mother feel she is not a good mother. High stress and poor coping skill can make her feel overwhelmed. Next, social factor which are related to mother environment and support system. Lack of support from family and a partner can make the mother feel lonely. Relationship problem can increase the emotional stress, financial difficult, also can contribute the pressure. Unplanned pregnancy can make the mother unprepared mentally. Lastly, a social isolation can increase the risk a mother has no share their feeling to others. Adam, do you have any ideas?
Yes, I have about 3 more risk factors that I want to share. First, the biological factor. After delivery, there is a sudden drop in progesterone and progesterone hormones, which can affect a mother's emotional stability. Sleep deprivation is also very common because the mother has to take care of the newborn, and this can lead to both physical and mental exhaustion. In addition, any complication during pregnancy or delivery can increase stress and the risk of developing depression. Second one, obstetric and baby related factor. A difficult or traumatic labor experience can negatively affect the mother emotionally. If the baby is born preterm or has health problem, it may cause the mother to feel more anxious and overwhelmed. Breastfeeding difficulties can also lead to frustration and loss of confidence. And last one, lifestyle factor. Poor nutrition can affect both physical health and mood regulation. On the other hand, substance abuse such as alcohol or drugs can worsen emotional instability and increase the risk of depression. That's all. But I wonder about nursing treatment. Do anyone have that point?
I have a few points about nursing treatment for a patient with postpartum depression. Firstly, the nurse should establish a good rapport with the patient. This is important to gain the patient's cooperation and build trust. Secondly, the nurse should spend more time talking with the patient. This helps to prevent the patient from feeling unwanted. Thirdly, the nurse should ask the patient whether she is experienced similar symptoms before. This information is useful for planning appropriate nursing care. Next, the nurse should also assess risk factors for depression, such as family or marital problems, stress, history of mental illness in the family, and drug or alcohol use. This allows for further action to be taken if needed. Umaira, do you have any other points to add?
Okay, I will continue about the nursing treatment for postpartum depression. First for me is assist the patient in the care of the baby. The nurse should assist and guide the patient in caring for her baby. This helps to boost the patient's confidence and strengthen the mother and baby bonding and gain the trust of the client. And then next, we should also monitor the patient closely, such as behavior and the attitude. The nurse need to closely observe the patient behavior and attitude because this is important to assess any signs of aggressiveness or abnormal emotional response that may require further intervention. And next, we should also give emotional and physical support to the patient because providing both emotional and physical support can help reduce the patient's stress level and promote a sense of comfort and security during the recovery. And lastly, for me, encourage husband and the family members to give full support because the nurse should encourage members to provide continuous support as strong as family involvement plays a significant role in the patient's recovery process. That's all from me.
Okay, based on what has been discussed just now, we can see that postpartum depression is a serious condition that should not be ignored. Early recognition and proper support are very important to ensure well-being of both the mother and the baby. As healthcare providers, especially nurses, we play an important role in identifying symptoms, providing care, and offering emotional support. So that's all from us. Thank you.
Thank you.